Good day to you. You are welcome once again to Health Issues with Dr. Paul. And this particular episode we are going to look at what we call appendicitis. Yeah, a lot of us hear about and talk about appendix, she has an appendix, she has an appendix. So what is appendicitis? Appendicitis has to do with the inflammation of the appendix. And what is this appendicitis? The appendix is a tube-like structure, just like the shape of this my finger, that projects from the lower aspect of part of the intestine called colon. So it's usually on the right side of lower right side of the tummy. That's where the appendix is positioned, and this appendix can get inflamed. Maybe as a result of blockage of the lumen of the appendix, it gets inflamed. And once something gets inflamed, what happens to it? It tends to swell up, and it tends to begin to cause some discomfort to the person. So that brings us to the symptoms that you are going to see in a patient that has appendicitis. Number one is pain. Pain. For a lot of people, this pain starts around the umbilicus, around the navel, and then gradually settles on the right lower aspect of the tummy. For other patients, the pain will just start at the lower right aspect of the tummy and stay there. Some people will begin to experience what we call nausea. You get nauseated, you feel like vomiting, and that can progress to actual vomiting. And for some people, it's just vomiting, feeling the pain. Fever is another symptom that we see in patients that have an appendicitis. This fever can gradually worsen over time. Some people can have diarrhea, others can have constipation, some people have bloating of the tummy. So when you have an appendicitis, it's not something that should be taken for granted. There are quite a number of things that can be done for a patient that has got an appendicitis. If you feel you have any pain in your tummy, classically what they're supposed to do, they're supposed to get to the hospital. The doctor will ask you questions, and then we'll run some investigations, including ultrasound scan, which is the basic way of making a diagnosis of appendicitis. When an ultrasound scan is done, it will discover that the appendix is now swollen. We look at the dimension, the size of the appendix, we discover that it's now bigger than what it used to be. At that point, you can now say categorically, okay, you have an appendicitis. We're now talking about the things that are supposed to be done in terms of treatment. Most times, you start with antibiotics. From there, you will move on to surgery where necessary. And in terms of surgery, the good news I have for you is that the surgeries for appendicitis, it's not just open surgery that is available to us in an environment these days. Like in our hospital, early specialist hospital, in addition to open surgery, we also do what we call laparoscopic or keyhole surgeries, where just through tiny hooks you can go in and take care of this appendix so that it doesn't result in further problems. So these things are done the earlier the better. So if you are someone that is afraid of surgical scars, not I don't have scars, the technology of keyhole or laparoscopic surgeries makes things easier for you. You can always check on us, you can always ask questions, and we'll direct you on what to do. Thank you very much for watching. Bye.